Do you think food increases creatinine? Do you have CKD and are confused about what to eat and what not? This video series will help us understand and hopefully answer all your worries. In part 1, I discussed about what is creatinine and what are the diet restrictions suggested for patients who have CKD with respect to water and salt intake. This is the part 2 of diet in CKD video series, and here I will explain about dietary changes with respect to protein, phosphorus and potassium. Let me talk about protein restriction. Do you also think that protein should be stopped in CKD as it increases the creatinine? Well, this is partly true. Let me explain you in detail about protein intake in CKD and clear your myths. Low protein diet actually helps in reducing load on the kidney filters and helps in slowing the progression of kidney disease. However, most Indian diets are actually low in protein. So restricting protein or common protein like pulses or dal in Indian food leads actually to malnutrition. So malnutrition puts you at risk of infections. So how much protein you can take? What does the recommendation say? 0.8 gram per kg of body weight is the protein allowance for CKD up to stage 5. That means for an average of 60 kg person, 50 gram of protein per day is allowed. There is also a concept of very low diet protein where 0.3 gram per kg of body weight protein along with alpha ketone analog, that is amino acids, was found to be helpful in some studies. But in Indian settings, it results in more of a malnutrition. Also, this alpha ketone analog comes in a form of a tablet and increases the pill burden because you have to take 6 tablets extra per day. They are costly too. So increased pill burden, risk of malnutrition and cost make this low protein diet unsuitable for most of Indian patients. Is there any difference in the type of protein? Yes, there is. Let me explain. So prefer vegetarian source of protein over non-vegetarian protein. But why? Because animal-based protein cause more acid generation in the body and put more load on the kidney filters. They come with saturated fats, they generate more phosphorus in the body. So all this actually contribute to worsening of kidney functions. But there is a problem here. Most plant-based proteins are actually incomplete, which means they have deficiency of few amino acids which are essential for the body. So what shall we do to compensate for this? How to make your diet complete? So a plant-based protein diet can be complemented with some animal food like egg whites, low-fat milk or milk derivatives. And lean meat will often meet the nutrient needs and make your protein complete protein. In short, prefer veg proteins, complement with suitable non-veg protein. I hope I am clear about the amount and the type of protein. Do calculate your protein intake and optimize the amount as per your weight. Let me talk about potassium now in diet. Due to reduced filtration, potassium increases in blood. So high potassium actually can interfere with beating of the heart. Potassium restriction is very important in advanced CKD, and as in these patients, they usually have a high potassium because of reduced filtration. We need to know the type of food which actually contain high potassium and restrict them. Usually the food which have high potassium are green leafy vegetables, coconut water, fruit juices, vegetable soup, various different salt substitutes which actually compensate for less sodium by adding potassium into it. So then we come to leaching. Does leaching help in reducing potassium? We can actually leach leafy vegetables, which is boiling and throwing the water. It removes other nutrients also along with potassium. So leaching of vegetable I usually recommend in patients only when they have hyperkalemia, they have high potassium. So what are the low potassium fruits and vegetables which we can use in case of hyperkalemia? You can try apple, papaya, pineapple, grapes and watermelon. They are low in potassium content and can be used in moderation. Remember, moderation is very important. Avoid hidden potassium foods like highly ultra processed foods which contain potassium additives. Salt substitutes, which actually have more potassium than sodium, and potassium containing preservatives. You will be surprised to know that preservatives and salt substitutes like low sodium salt and light salt cause more hyperkalemia than vegetables and fruits. The size or portion of fruit and vegetable is more important. Take in moderation. I think I am clear about diet and potassium in CKD. Let's move to diet changes, how to control phosphorus. Now, phosphorus. Dietary protein is the main source of phosphorus. High phosphorus causes weakness of bone and calcification of blood vessels and heart problems. Shall we stop protein totally then? No, we have to choose them wisely. There are two factors which are very important and they play important role here. One is protein to phosphorus ratio and organic versus inorganic source. Let me explain protein to phosphorus ratio. So we know every protein is different in their capacity to generate phosphorus in our body. Non-vegetarian source protein except egg white basically has a high protein to phosphorus ratio. Vegetarian protein sources not only have low phosphorus, they also have phytates, which does not allow phosphorus to get absorbed. So it's very clear veg protein and eggs are to be preferred here. Now let me come to inorganic versus organic phosphorus. Inorganic phosphorus, which is present in processed food and preservatives, is completely absorbed. So we have to avoid them strictly. Wait, there are some common hidden sources of phosphorus. Let me talk about them. Beverages like colas, cokes, chocolates, specially processed, enhanced meats, frozen meals, processed or spreadable cheese, instant foods, refrigerated bakery products. They are high in inorganic phosphorus and we know they are completely absorbed. So we have to completely avoid these food items. Remove these items from your diet strictly because we do not know they have phosphorus and they are hidden sources. They can increase your phosphorus. Choose your protein wisely. Prefer vegetarian source and egg whites. Avoid non-veg and processed food. Avoid food with preservatives. Don't stop all protein as malnutrition can be more dangerous. Soaking and boiling reduces phosphorus content. I hope I am clear about the diet changes in CKD patients. Do remember, these are general recommendations. You need to consult a nephrologist to understand diet requirement according to your body. Forward this to a person who needs to know this and let me know the comments if you need to know anything further about CKD. Thank you.